Welcome to our PowerPoint on Ritalin and the effects on children. Our group members are Anna, Gabby, and Cassandra.
Methylphenidate, the brand name Ritalin, is an amphetamine-like CNS stimulant used to treat ADHD in adults and children. It is a Schedule II controlled substance. Ritalin is currently prescribed to approximately 6 million people in the U.S. 75 of these are children, with boys receiving Ritalin about 4 times more often than girls. Methylphenidate is a central nervous system stimulant that affects chemicals in the brain related to impulse control and hyperactivity. It was created by Leandro Penazon in 1944 and named Ritalin after his wife. Was first introduced to Germany and Switzerland in 1954. First placed on the market in the United States in 1956 and sold as a light psychostimulant under the same class as amphetamines. First manufactured in 1944, Ritalin formula, commonly known as MPH from methylphenidate, improved in the 50s, was tested on humans in 1954. 1957, Ciba Pharmaceutical Company marketed MPH as Ritalin to treat depression, chronic fatigue, psychosis associated with depression, and narcolepsy. 1960s, used to prevent symptoms of barbiturates overdose. Ritalin and other stimulants used to treat ADHD steadily increased in the sales in the 70s and 80s. From 1991 to 1999, sales of Ritalin in the United States increased by 500%. United States produces and consumes as much as 85% of the world's formulation of Ritalin. In the 1960s, Abbott Laboratories did many studies on rats. Researchers in the laboratories learned that rats that were given amphetamine and other stimulants improved faster in performance than other rats that weren't given a stimulant. They learned that when testing these stimulants on humans in very low levels, it will affect the CNS and increase the arousal levels. If a person is very sleepy, this will improve their performance in trying to stay awake. At very high levels of taking these stimulants, it will also affect the CNS and increase the arousal levels. This will make the person perform in a repetitive state. They called this new smart pill Silert. Although this pill never made it to the market to improve learning performances, it did, however, come into the market as Ritalin, Adderall, and Concerta to help children with ADHD improve better academically.
Ritalin is a form of a psychoactive drug. We have a little video to play too. It's just right at the top. Ritalin is also considered a psychostimulant. Ritalin alters a child's behavior and the world around them through their thoughts and feelings. Children who take Ritalin become calm, and it helps them clearly gather their thoughts while trying to focus. Ritalin affects feelings, being able to control impulses and outbursts. The size and quality or dosage of Ritalin is dependent upon the route of administration. Effects are also connected to the history and expectations of the individual. Symptoms of ADHD, attention deficit hyperactivity disorder. There are 3 types of ADHD. The most common form is a combination of all 3 types: inattentive, hyperactive, and impulsive. These are the common symptoms of the 3. Unable to follow instructions, difficulty paying attention, whether it be school, work, or home, constantly in motion, squirming and fidgeting. They often have trouble playing undisturbed, excessive talking, interrupting or intruding in on others. They're easily distracted, and a lot of children struggle to finish a task.
Pharmacodynamics, effects on the brain. In the prefrontal cortex, Ritalin works by regulating neuron activity, enhancing cognitive function, controls your sense of morality, responsible for planning appropriate behavioral response to external and internal stimuli.
Cerebellum involves the continuation of balance and smooth movement. Cerebellum development delay, also known as CDD, is the cause of ADHD in adults. They're usually underdeveloped or smaller than average, unable to process information coming and going from the cerebrum.
The basal ganglia helps to balance behavior, can be over or underactive. Overactivity correlates to an excess of dopamine and a deficit of neurotransmitters, GABA and or serotonin. Oh God. Underactivity experience low motivation. Effects of amphetamines on dopaminergic systems.
Short and long-term effects of Ritalin on the body and the brain. Short-term effects are appetite loss, elevated blood pressure, heart rate, and body temperature, pupil dilation, interrupted sleep patterns, nausea, abnormal and sometimes violent behavior, hallucinations and irritability, panic and psychosis, and convulsions, seizures, and death from high doses.
Long-term effects: irreversible harm to the blood vessels in the heart and brain, and high blood pressure that leads to heart attacks, strokes, and death. Kidney, liver, and lung damage, weight loss, and malnutrition, disorientation, confusion, exhaustion, strong psychological dependence, psychosis, depression, brain damage, including strokes and possibly epilepsy. The central nervous system. After taking Ritalin, a person who has ADHD should be more calm and focused. Opposite effects happen when those who don't have ADHD take it. For a normal person, a neurotransmitter in the presynaptic neuron releases dopamine into the synaptic cleft, where dopamine will then bind the receptors in the postsynaptic neuron. Dopamine that is left over in the synaptic cleft get reuptaken through the presynaptic neuron, which is now pumped full of dopamine to be reused again. When Ritalin is taken, it initiates a series of chemicals activities in the central nervous system without ADHD. Once the amphetamines have gone through the bloodstream and carried to the brain, methylphenidate binds to the neurons that are used for the reuptake of dopamine into the synapse. This blocks the reuptake of dopamine, causing the levels within the synapse to rise. When the nucleus accumbens has large quantities of dopamine, a high sensation occurs. Ritalin also reduces background firings of neurons, decreasing distraction, letting a clear signal transmit through the brain.
Dopamine. Dopamine, serotonin, and epinephrine are used faster than the average person. If you lack these, you will become unattentive, impulsive, and hyperactive. Blood-brain barrier.
Dopamine is responsible for pleasure, euphoria, reward, motivation, and perseverance. ADHD and the brain. There is a video that explains, so for those that learn better with visual, if you just click play and it will take you to the video.
Serotonin. Serotonin controls sleep patterns, regulation of body weight, and food intake. It controls mood levels such as depression if serotonin is low. Many children who are diagnosed with ADHD are actually manic or bipolar. These symptoms and signs usually get unnoticed until the child is on an ADHD medication for a long period of time. Also, many children who have low serotonin experience impulsive aggression. Many children who are ADHD and bipolar experience impulsive aggression towards family members and others.
Pharmacokinetics, my favorite. Routes of administration. There's inhalation, so inhalant, destructive to the nasal tissues from sniffing. Mouth, lungs, heart, and brain. The way it travels, rapid and effective, 5 to 8 seconds. Difficult to control dosage.
Intravenous or injection. Infectious diseases, abscesses, directly into the bloodstream, 10 to 15 seconds from the vein to the brain, and can deliver high portions of the drug.
Oral or swallowing. Respiratory problems, slow release, absorbed into stomach, affects liver, heart, lungs, and brain, distributed throughout the bloodstream. Before reaching the brain, connects with several tissues and organs.
There is cause for concern for abuse potential of methamphetamines and amphetamines because of the extreme high feelings of euphoria they produce. Abusing the route of administration in high doses, users become tolerable to its pleasurable effects.
Ritalin and cocaine. Ritalin and cocaine are similar stimulants that increase productivity and alertness. They look and act alike and have similar chemical structure. Both increase levels of dopamine in the brain. Research shows that 10 to 30% of cocaine addicts have ADHD. 30 to 50% of adolescents in drug treatment centers report abusing Ritalin.
And these two pictures here, the one on the bottom right is just showing the similar chemical structure between them, and the picture on the left is showing the dopamine, how it travels through into the receiving neuron.
Amphetamines and cocaine. A synthetic central nervous system stimulant and sympathomimetic travel to the brain and enter our nervous cell. Increase dopamine levels in 3 ways. Invades nerve cell following the synapse and push out extra dopamine. Then they plug the transporter molecules, preventing the reuptake of the dopamine, holding the dopamine at high levels. Amphetamines are bound to transporters. They cause the transporter to work in reverse, pumping more dopamine out into the synapse. A powerful and addictive stimulant drug made from the leaves of the cocaine. It comes from the cocoa plant native of South America, produces a short-term euphoria, energy, and talkativeness, while also potentially dangerous physical effects like racing heart and high blood pressure. Cocaine prevents dopamine from being recycled, which in turn makes excessive amounts build up in the synapse. Amplifies the dopamine signal and disrupts normal brain communication, constricts blood vessels, dilates pupils. And we have from the Mouse Party a video of cocaine and the effects.
Physical effects of amphetamines. In dopamine, when taken, you get a euphoric feeling, confidence, sociability, cravings. Afterwards, coming down, there's depression, fatigue, anxiety, paranoia, and anorexia. In norepinephrine, there's dilated pupils, sweating, red face, hyperactivity, restlessness, talkative, repeated activities, jaw clenching, teeth grinding, faster breathing, itchy, picking, nausea, chest complications, headaches, and insomnia. And this picture in the middle just shows the differences in the brain between cocaine and methylphenidate, which is Ritalin.
Facts about ADHD. U.S. researchers reported brain scans of children with attention deficit hyperactivity disorders show anatomical. Thank you. Abnormalities beyond the chemical imbalance. A second study by the same authors showed stimulant medication prescribed to balance brain chemistry appeared to normalize some of these brain irregularities. We found abnormalities of the fiber pathways in the frontal cortex, basal ganglia, brainstem, and cerebellum, said lead author Menzar Asteri. These are involved in the processes that regulate attention, impulsive behavior, motor activity, and inhibition, the key symptoms in ADHD children.
Dependence potential and withdrawal symptoms. High-dose effects of Ritalin are paranoia, schizophrenia, psychosis, which could be hearing voices or visual hallucinations, and harming others. Withdrawal symptoms are tiredness, panic attacks, psychosis, irritability, extreme hunger, depression, and nightmares.
Ritalin, the smart pill. A number of American surveys have found shocking findings on students that are abusing stimulants. Many students turn to cognitive enhancing drugs such as Adderall, Concerta, Ritalin, and even speed to help them perform better academically. They're often referred to as smart drugs. Many students are taking Ritalin and other cognitive enhancing drugs because coffee, which is another stimulant, doesn't help them focus on assignments and classes that seem boring. Students were being sold Ritalin by other students that were prescribed these cognitive enhancers by a physician. In 2008, a survey on students on campuses in the United States indicated that 1 in 4 students were using these stimulants medications for non-medicinal purposes. And we do have a video. It's about college students and that the girl in the video actually is misusing Ritalin.
Acute toxicity. Most symptoms include euphoria, delirium, confusion, toxic psychosis, and hallucinations. At moderate doses, decision-making can be temporarily impaired. When high doses are administered for long periods, the user will become easily panicked to the point of paranoia. Combined with increased feelings of power and strength, incidents of violence may increase. Violence is a lifestyle characteristic of many methamphetamine users. 3 factors that by themselves may lead to more aggression with increased use of amphetamines are 1. An impaired capacity to control or inhibit aggressive impulses, 2. Associated with increased symptoms of psychosis, mainly paranoia, and 3. High levels of increased impulsivity related to amphetamine use. Chronic toxicity. One of the effects of the development of a paranoid psychosis would be continuous cocaine use. Reasons for psychosis are that heavy methamphetamine users have schizoid personalities and that psychosis is caused by being sleep deprived. Evidence shows that paranoid psychosis results from dopaminergic stimulation in the mesolimbic system. Compulsive and repetitive actions are another behavior induced by high doses of amphetamines. The behavior could be acceptable, like cleaning the same room again and again, or bizarre, like counting all the stars in the sky.
Stimulant toxicity. Psychiatric side effects of methylphenidate, similar to those of cocaine and amphetamines, given more support to the idea that almost all central nervous system stimulants will produce a similar clinical picture. A person using cocaine can experience nervousness, restlessness, agitation, suspiciousness, paranoia, hallucination, and delusions, impaired cognitive function, delirium, violence, suicide, and homicide. All patients should be informed of the risk and abuse potential of methylphenidate. Drugs used in treatment for ADHD. There are many drugs today used to treat ADHD in children. There are a class of drugs called psychostimulants, or sometimes just stimulants, that are highly effective in treating children with ADHD. Adderall, Vyvanse, Concerta, Focalin, Daytrana, and of course Ritalin are all classed under psychostimulants. Adderall is a very dangerous stimulant drug, very similar to cocaine and methamphetamines. And there's another video, really good video on how does Adderall work. And they do talk about Ritalin as well in the video.
Daytrana is a patch form of methylphenidate. The route of administration is transdermal, which is where the active ingredient is placed on the skin and enters the bloodstream. Daytrana is commonly used for children who are unable to use the route of administration orally. Parents are advised to place patch on the child 2 hours before they start school because it takes 2 hours for that route of administration to start working, allowing slow, continuous retention. Common side effects from Daytrana are mood swings, dizziness, tics, vomiting, nausea, stomach pain, appetite loss, weight loss, problems sleeping like insomnia, skin redness, bumps, or itching around the area of the skin patch. And this down here is just a little picture of the patch size and the different milligrams or dosage that they give it out in.
Concerta, prolonged release tablets, only pill form available. Also used to treat sleeping disorders such as narcolepsy. Commonly used today. Side effects: nervousness, problems sleeping, appetite and weight loss, dizziness, nausea, vomiting, and headaches.
And the picture down at the bottom is just the top 10 reactions of taking Concerta. So we thought that was a good idea.
Benefits of Ritalin. When Ritalin is prescribed by a doctor and taken as directed, it is not addictive. Ritalin is issued in a pill format, so it takes longer to reach the brain, while cocaine is usually taken in high doses, injection or snorting, flooding the brain quickly with dopamine, making it dangerous and addictive. Ritalin is a pharmaceutical drug, which is commonly used to treat attention deficit hyperactivity disorder, or ADHD, in children and adults. Before children are diagnosed with ADHD, they show many symptoms that affect their everyday lives. Ritalin has a
Physiological.
Effect on parts of the brain that are connected to impulse and attention control. Dopamine works to help people in controlling their behavior. Ritalin helps to increase dopamine levels, enabling those with ADHD to focus, reduce distraction, and making decisions based on logic and not emotion.
Why is knowledge of Ritalin important? Ritalin is a pharmaceutical drug which is commonly used to treat ADHD. As a social service worker, we may come across children and adults that have experienced the effects of Ritalin and other methylphenidate stimulants. The adverse effects have a wide range of symptoms that are usually long-lasting, even years after discontinuing use. This may result in the use of recreational drugs and the misuse of pharmaceutical drugs. Knowledge of this information is very important considering the abuse that occurs with the prescriptions of methylphenidate stimulants and the dependence potential of each separate medication. And that's it. We hope you guys enjoyed our presentation.
And I hope we've informed you all on Ritalin.
Bye.
Thank you.